Hey, I got one question before I'm going to cut in on you.
No, you're good.
It wouldn't be up to him anyway.
Right? I mean, I heard you say it right there.
I didn't hear him say that.
Because, you know, it's all bad. It's no life.
It's not a criminal
Yeah.
proceeding.
Right. Is Mike going to be here?
I thought he was.
We're going to wait a few more minutes. Mike Page is running behind, so maybe running.
Got a 32-minute recording.
Yeah. You're it.
Anything coming? Is anything coming?
Yeah, he's here.
Look like you worked hard today.
I didn't even recognize you without all that.
Yeah, it's hard to recognize when I'm working.
Doesn't happen very often.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
God, we ask you to guide the commissioners today as they discuss county business and make decisions regarding the county. We pray that you would watch over the employees of the county and protect them. And we ask, God, that you would guide the citizens of the county, that we might serve you by the way we live our lives. We pray in Jesus' name.
Thank you.
All right. First off, thanks for everybody coming out and joining us today in this special meeting. Where do we start, Gary?
Where's our health department? You want
Was she here?
Well,
Is she?
I've given you a little bit of an agenda here that I think you'll probably want to follow. First thing we probably should do is go over the governor's orders. That's the main reason we're here. I think we have some other related issues, but that's the main reason we're here. So let's take a look at this order. This finally came out this morning. As you know, we set our meeting for this afternoon because we knew this would come out sometime today, and we were fearful that it wouldn't come out till late in the day. It actually came out about 10 o'clock this morning, but we didn't know that. What the governor's order does is require the wearing of a mask basically anytime a person is in public, with some exceptions. Any person in Kansas, this is on page 2, shall cover their mouth and nose with a mask or other face covering when they're in the following situations. So here are the situations in which the requirement applies. Inside or in line to enter any indoor space. Obtaining services from a healthcare sector in a variety of settings that they list there, including hospital, pharmacy, clinic, laboratory, dental office, and so forth. 3, waiting for or riding on public transportation. 4, in any outdoor space when you're unable to maintain a 6-foot distance. So basically it covers just about anytime you're in public. It also includes a requirement that businesses require that their employees, customers, and visitors wear masks unless they're in a room by themselves or able to maintain a 6-foot space. There are several exceptions, those that have a medical condition that doesn't allow them to wear a mask, anybody under 6 years of age, the hearing impaired, or anybody communicating with someone that's hearing impaired. Anytime wearing a mask would create a risk to the person involved. And if you're in a restaurant eating during the period in which you're seated and eating, if you can maintain a 6-foot space. Also exempted are athletes who are engaged in a sports activity, if they're able to maintain a 6-foot distance. And persons involved in a court proceeding when they're able to maintain social distancing. And I noticed that they also exempted the Kansas legislature. So that's the essence of I mean, it's a 5-page order, but that's the essence of the order. House Bill 2016, which was passed back before the legislature adjourned, allows county commissions to opt out under certain conditions of a governor's emergency order of this type. Here are it says the Board of County Commissioners, this is on the second page of that statute, I gave you down towards the bottom, or 2/3 of the way down. The Board of County Commissioners of any county may issue an order related to public health that includes provisions that are less stringent than the provisions of an executive order effective statewide issued by the governor. Any Board of County Commissioners issuing such an order must make the following findings and include such findings in the order. Number 1, the board is consulted with local health care officer or other local health officials regarding the governor's executive order. Following such consultation, implement of the full scope of the provisions of the executive order are not necessary to protect the public health and safety of the county, and all other relative findings in support of the board's decision. And so, as county commission, you do have the option of totally opting out or in other ways limiting the extent of the requirements of the governor's order. I have taken the liberty of laying out some of your options, okay, just so we've got a direction to go. One of your options is to do nothing and let this order stand as it is. Right now, it is going into effect at midnight, and it will be the standard for the state unless counties opt out. If you let that happen, then everyone in the county would be required to comply with this. The enforcement is something of a discretionary thing. Enforcement is not through a criminal process. Enforcement is through a civil process, meaning that it would be the responsibility of the county attorney to file a civil action in district court against anybody that he wanted to proceed against on in violation of this. As a result, as I say, it's I'd say relatively discretionary. I don't want to say that it couldn't be enforced, but enforcement, I think, would probably only occur in the most egregious of circumstances. For example, someone who knows they're sick is going around, infecting people, something like that. So one option is to do nothing and let things stand as they are, or as they will be beginning at midnight. Second option is to take steps to limit the order. And you've got several sub-options there. You could totally exempt the county from this order, thus there'd be no mask requirement whatsoever. You could eliminate some of the requirements, but leave some. For example, you could leave a requirement that people in a clinic have to wear a mask, or a requirement that people in large meetings where they can't socially distance have to wear a mask. Right now, that's a request, that's a suggestion. You could leave that as a requirement if you wish to. So you've got the option of eliminating the requirement altogether, of limiting the requirement to just certain situations. Another option you might consider is eliminating the requirement, but urging businesses to take it upon themselves to make their own requirements. For example, I think what my office is going to do, at least for the foreseeable future, is require that anybody that comes in be masked. Does that mean I'll lose business? Well, maybe so. But, I'm an old guy. I'm in the vulnerable category, and as long as the numbers are spiking like they are, that's something that I have a little concern about. So you might not have any requirement, but ask businesses to assist by making their own internal requirements. Some of the things I think you ought to consider as you talk about this, you ought to ask questions or discuss the efficacy of masks. How effective are masks in preventing the spread of the virus? Our county health nurse is here. I know she'd be happy to talk with you about that. You may have other experts that could talk about it. I know that I was reading today that in states that had a mask requirement in June, the incidence of new cases in those states went down 25% during the first 3 weeks of June. In states that did not have a mask requirement, the incidence of new cases went up 80%. And so there are studies that seem to indicate there is some efficacy. Does that mean that it's worth doing? Well, you have to make that call. I think that experts indicate that masks probably protect other people from you more than they protect you from other people. Does that make sense? That by stopping your own saliva and so forth from spreading around, they're protecting others from you. A second consideration I think you ought to take into account is the impact on personal liberty. I mean, that is a legitimate concern. It's clear that the government has the power to make this requirement, but is that the way you want to approach this? You need to make that determination. I know that a lot of the people who have concerns about this, they're not really concerned about wearing a mask. They're concerned about the government requiring them to wear a mask. And I think that's a legitimate concern that you need to take into consideration. The third consideration I think you need to look at is the degree of risk involved in this. On the one hand, Linn County has a high percentage of vulnerable people. A very significant part of our population is my age or older, and lots of underlying health conditions and so on. On the other hand, we have a pretty low incidence of cases. It has been increasing, and you may ask our health nurse to talk about that. But it's not as though we've had hundreds of cases in the county. If not wearing a mask leads to further outbreaks, there is a possibility of a total shutdown at some point. I don't think you guys would ever initiate one. It would be state initiated. But that is a possibility. If things just burn up, it's possible that there'll be a total shutdown. If it were a choice of a mask requirement now or some kind of effort to encourage use of masks now, as opposed to a shutdown in 3 weeks, that might be a risk that people would, they maybe would rather risk using a mask now than risk shutting down later. And then the final thing that I think you want to consider is the symbolism of all of it. No matter what you say, the mask has kind of become a political symbol. And I don't think that's necessarily a good factor to base a decision on, but it's definitely a reality. And so you've got to, one of the things you're going to need to do is balance the symbolism with all the other factors that we've talked about here. So with that little bit of direction, I think you need to discuss with one another what you think about this. Maybe you already know exactly what you want to do. Maybe you don't. You are free to take comments from the public. You don't have to if you don't want to. That's up to you. As always, unless it's a public hearing, it's your meeting, and so you can conduct it as you wish. And so I've given you some direction. Now it's up to you.
Tisha, you want to come on up and speak to us? And has Jamie, the prosecuting attorney, reached out to anybody about what, his procedure in prosecuting? If
I haven't heard from him. I think Rick said that he had indicated.
He had initially made a statement that it was a civil matter, and that's my biggest issue is with it, the whole thing. I'll just cut through. Sorry, Tisha, we just kind of started. The sheriff's department. Some people will follow the order if you tell them, and some won't. And the ones that won't, and the ones that do, will collide, and there'll be phone calls, and there'll be unnecessary phone calls on the sheriff, and there's no way to regulate it, period. So that's my biggest issue with it. Other than, we should have our own rights and respect each other's rights to do what they see as they need to do if their health is in question. So those are my two big issues, but so no, I haven't directly spoke to him. He spoke up here very briefly, and I just talked to Kevin about it a little bit, and you don't know what his stance is on it at all?
I do not.
maybe
Okay.
we can give him a call. We'll hear some people out. Maybe we'll give him a call and see what
I
his.
did send him a notice of this meeting, so he knows we're here today, but I don't know what he's doing.
Tisha, go ahead. We'll get in contact with
Okay.
him.
Tisha Coleman, Linn County Health Department Administrator. I will give you kind of a situational awareness of what's going on locally. Since Monday, we've gone up 2 cases. I have my nurse back. We will put out a number on how many have been tested as of 5 o'clock tonight. But as of me coming over here today, there has been 82 tested. That has been a significant increase since last week.
And you've had now you're up to 17 cases? You had 15 Monday, I believe it was. 2 was active, right?
If I remember right, yes, 2, or yeah.
So now
we've
you
gone
have
up 2
4
cases.
active cases?
So we're back down to 2,
Okay.
if I recall. I'm not doing all that investigation side of it, but I'm
Okay.
getting the updates. And if I recall, they are now, one is probably still considered active
Okay.
because of the recovery. So that's just situationally in Linn County. I will also tell you that with the most recent cases, we have had an increased difficulty in doing contact tracing. Therefore, you have the potential of people who have been exposed walking around the community. And when they become symptomatic, their exposure, if I'm around you and I'm walking around, I mean, it's 2 days before the symptoms start. So the exposures occurred. In the state of Kansas, they've added 2 states to the travel quarantine list. So we have currently Alabama, Arizona, Arkansas, Florida, South Carolina on there. Maryland dropped off. Of course, international travel and cruise travel is still on there. In Kansas, the case trending, I wish I should have brought their, I mean, you can get on their website and see what the map or the graph looks like. I should have got on there and looked at that or brought it to show you today. But since the recommendations of the governor, since the governor's orders went to recommendations, there's been not only an increase in the trend, but a sharper increase in the trend. So we've had an increase, uptick of cases, uptick of hospitalizations. Death has had a sharp increase in the trend and increase of ICU and ventilator use. Just giving you what's going on in Kansas. I do have some studies. I can read to you kind of a summary of one of them if you wish, that tells basically the conclusion is face mask use by the primary case and family contacts before the primary case developed symptoms was 79% effective in reducing transmission. So, I mean, I can read the whole thing to you if you want me to, but that's basically the moral of the story. That's one study. I have 4, and there's many more out there of evidence, scientific data. Masks, we're talking about schools opening. We have to look at the long-term picture as far as if we want businesses to stay open and we want schools to start, we have to see a decrease in cases. And I don't know I mean, my anticipation is Linn County is going to go up in the next couple of weeks, just with what we've got going on. And, you know, with businesses, how we did in the beginning of the curbside service and things like this will, if they wear masks, that will help them to stay open versus being shut down because of no staff, and it's to protect their staff. Do you have any questions?
I don't have any questions.
With that, I assume you're recommending that we follow the governor's order.
Okay. Does Doug want to say anything? Doug in here? Did you want to make a statement?
I don't need to, whatever you guys decide. He's the expert on medical, I'm not a medical person, so I can tell you that the Director of Health and Environment, Dr. Norman, is recommending it, and they have put out charts. Let me just draw it on the board for you.
Well, he's walking over to do that. I'm going to interject. I did not mention the fact that the masks are if there's social gatherings or gatherings that are not occurring. That's where, because gatherings and mass people together is how it's transmitted. And so if you outside can socially distance, then, I mean, that's better. I mean, that's the question we're asking people. Who have you been in close contact with? And close contact is within 6 feet for 10 minutes or longer.
That's May 27th. There was kind of an exponential curve when this first started. It started out kind of gradual, and then it shot way up. Now, it receded down to May 27th, and now it's up on a line that's sharper than what it was at this point. And that's just the information we've got from the state, suggesting that it's on a higher increase than it was in the beginning. So if we don't do something to try to stem the tide of this situation, I think we're gonna be back in a mandatory lockdown, same as we were 2 months ago. The other thing that I have heard in the conference calls with state emergency management and health and environment, this has modified slightly from the original strain, and the new strain, you know, it's a circle and it's got all these little fingers on it, for lack of a better way. Again, I'm not medical, so I can't explain it from a medical term, but my understanding is there are now more in this newer version that's here. There are more of these, they're longer and stronger, so they can attach to something better than what the original strain in China was doing. And
They're called protein spikes, and there are more of them, which makes them more infectious. Not necessarily more lethal, but more infectious.
so the disease we have going around right now, they say is probably more infection than it was when it was in China and some of the other countries, and perhaps that's why we're seeing bigger increases. And that's the information I have.
Thanks, Doug.
Yes, sir.
So, Tisha, I hear people say, let it, let's let it run its course and whatnot. I mean, putting a mask on people, is that just going to slow it down from running its course and getting through this? Or, I mean, that's probably not a question you could answer, but.
Well, I mean, yes, potentially, but we're also protecting most of our population, which is, I don't remember my percentages, I didn't come with those numbers, but what I talked about in the beginning with the elderly, they're the ones who are more adversely being affected. And so, if we have everybody running out and spreading it, then we may have several adverse effects.
I saw that of the 32,000 people, or 132,000 deaths so far, right? Of that number, a smaller number died just from the virus, more in the neighborhood of 80,000, about half of those folks. And of that number, about 150 were under 40, and about 68,000 were over 60. I mean, that's when I got serious about trying to protect myself a little bit.
And from today's webinar, the case demographics, if you will, the age is coming down to the 20 to 30s age range. And they maybe, maybe they're more active, they're more outgoing, they're going more places type thing.
So for the past few weeks, everything's been advisory. How is that different from our first stint with that lawsuit that we were in? How's this any different if we're going to try to mandate this and the contact tracing?
Well, we're not mandating anything. Okay, let's be clear. The governor has mandated this. We're considering undoing that. Okay, so that's the first difference. So if anybody's going to sue, they're going to have to sue the governor, not us, because this isn't our law. But the lawsuit was not about the various restrictions. It was about the requirement that people provide contact tracing information. And this has nothing to do with that. That was a search and seizure question. And this is not related to that at all.
I mean, Mike, you've been kind of quiet. What you got? What are you thinking?
Well, one, we've probably got 25 people here. Are we going to take a vote after maybe we discuss this? And just because I'd like to have your input, but obviously not 3 hours worth of it. So I do have a couple of legal questions I would like to ask, just ramifications probably in executive, but toward the end of this, before we make our decision. I had it in my mind that, I'm glad you mentioned that it would seem reasonable that if a business or whatever business would come in and they could post it, whether it's no shirt, no shoes, no mask, whatever, we don't want you in here unless you're wearing your mask, that's a individual business owner's decision. Okay, and at me, as John Q. Public, whether I'm conservative or I'm not conservative, I can walk up to that and say, well, I'm not going in there. You know, I'm not gonna take that risk to take it to my parents, or, you know, I'm going to sit down, whatever, or vice versa. But I think that it at minimally ought to be a recommendation that's well posted. Now, obviously, as you pointed out, somebody comes on in, sits down, and says, sir, you're not gonna wear a mask, I'm gonna need you to leave. It's gonna create some grief. And then my question is, one of the questions I have is that a legal issue? Now, if the proprietor said, you need to leave, and you refuse to leave,
Are we talking
That's
about
different, though.
if this order is in place or it's not in place?
well, even if we say, okay, we're gonna opt out, and put the onus of this on the individual business owner. Now, there's public meetings that are going to occur, or gatherings, and, you know, do they need to post whether they are going to require a mask or not require a mask? If that's a situation that we end up in, or?
Do they, each proprietor, whether it's a business or the county courthouse or whatever, would need to take it upon themselves to make any decision that they want to apply in a situation like that. And they would, you know, you'd want to post it. I mean, you don't want people to wander in. If you don't want people in there without a mask, you don't want to have to wander in to find out if they've got to have a mask on.
Exactly.
So, yeah, you'd want to post it.
Okay, so assume this July 3rd, 4th coming up, and there's a social gathering at Mound City. And so are they going to need to post that, or would we want to say, all right, if you can't maintain 6 foot of distancing, then you need to mask as a community, because it's not a business or proprietary owned thing, it's a social gathering. You just either need to mandate that you either socially distance, or
None of this applies in a private home.
I'm talking about a municipal event or something like that.
Okay, well, again, it's the control of the facility, I think, would be the issue that would, that's, whoever controls the facility would control that, if it's an event in, the church, then the church leaders would make that determination if they're gonna post it or not, and they're gonna make that requirement or not. This is all assuming that we exempt ourselves totally from this order.
Correct.
Kevin, you want to step up and add anything? You got anything to say?
David, did you have any numbers from any other counties?
One of the clerks in the state had sent a question out to all counties asking what they were going to do. I was just watching emails come in. At the moment, 13 counties that have responded said they are not going to require masks, but they're going to highly recommend it, or something along those lines that they're not requiring. One county has said they're not going to meet again until Tuesday, but they probably would require to wear masks and would follow the governor's order. And looks like about 5 more that responded so far. We're having meetings today or tomorrow. No results.
I noticed that Johnson County Commission.
Meeting now, right?
Well, they met earlier today, and
They followed.
And they agreed to comply with the order.
Okay, and I have not seen that yet.
Yeah, they did that about 2 o'clock.
Can we I'd like to talk to the prosecuting attorney, see what he has to say on, actually, he just texted me, he must be watching. He said, call me and I'll give my opinion. Can we call him on is that what we call him on?
David can set it up.
Yeah,
I'd like to call him to see, I just want to see what he says about,
You got his number?
Let's broadcast it over.
Yeah.
Yeah, it appears to be plugged in, so. This will be going out for everyone to hear, so, for anyone
you
that's
hear that, Jamie?
close enough to hear this.
How does that work? Hey, Jamie, it's Danny. You're on speakerphone right here in the middle of the special meeting, and you're obviously watching. I got a text message from you. So what's your opinion on it, on prosecuting and whatnot?
Well, so in relation to prosecuting, I'll give you, or the long version of it is, I don't like prosecuting speeding tickets. That's we do it, when somebody's going 5 over. There's a litany of things that prosecutors don't like prosecuting, but we do it because it's on the books and that's what we're supposed to do. If the commission elects to go along with the governor's order, then we go ahead and handle what we need to handle. We do have discretion on whether we will move forward on filing any actions. But I can tell you, if it's on the book, we'll use our discretion. But at the same time, we're probably going to end up filing things because that's what we're supposed to do. So it will be followed if you guys go along with it. I will tell you, I know Gary brought up what the courthouse could possibly do and so forth. So everybody's aware. The Supreme Court just came down today on 2020 PR 90 saying they're going to follow the governor's order in relation to all appellate and district courts. So the court system is being mandated to follow that through the Supreme Court. So that is occurring. And it is correct, Johnson County as well is complying with what the governor's order is. I really can't give an opinion on whether I think it's appropriate or not. I know that I'll be wearing a mask. That's my own choice and so forth. But as far as the county attorney's office is concerned, if it's there, we have an obligation to do what we're supposed to do. And I'm not going to give an opinion on whether or not I want to do it. But I'll say that if it's there, we have an obligation to do it. And we will comply with that and handle it if necessary.
You guys any questions for me? Is that all you got, Jamie?
Yeah, at this time, there is one thing, it's not in relation to this, but I want to make something clear. Kevin Friend sent an email to the commission and a few other people today. I want to make sure that the commission is clear that I agree with what Kevin had sent and the documents he reflected to you guys. Frankly, that garbage needs to stop. And I hopefully that it will, and we'll sort of go from there.
That's probably something we can talk about later or something on Monday, so we'll,
Yep.
I appreciate you answering, and we'll get through this and go from there.
There will be one thing, though, Danny, is, and I'm sure Kevin can chime in if he chooses to, I'm sorry, Sheriff Friend, is the enforcement portion will be very difficult. And the reason I say that is you've already got law enforcement that is having to do what we normally do anyway. And, our traffic numbers are down, but they better be down considering we want to shut down. Our criminal numbers are up and so forth. So law enforcement is working regularly and busting their tail to get certain things done, and we've been extremely busy. With that being said, you stack on expecting law enforcement to go around making sure people have masks and so forth, that is going to put a burden on the sheriff's department and all the other departments. And I think that is a factor that needs to be considered when you're looking at what we're supposed to do, and sort of go from there.
Okay, is that all you got?
That's all I got. Any questions?
I don't think so. Thank you, Jamie.
No problem, bud.
You guys got anything?
Well,
Did you have something you want to discuss in executive session, Mike, or not?
Well, when we get down to the end of where we need to be, are you going to take a poll? Or, we've discussed some education, or just, are you not planning on opening this up to complete public? Are you?
I would like to hear, I'd like to give them time. Everybody came out and maybe keep it kind of short. Maybe.
can we do a poll first just to see?
Yeah, that's what you guys want to do. Let's do it.
Let's just do a poll real quick. If we were not to mandate this, not require you wearing a mask, how many are in that category is not in favor of it? Okay. And then, is there anybody in favor of it? Yes, ma'am, you are. And of course, my health department.
Can I say something?
Yeah, Come on, we'll open it up for public comment for a few minutes. All
I'd like to be next.
right, state your name first.
Janet Cleveno, Linn County Treasurer. Most of your elderly wear masks. Most of the people that are scared wear masks. I don't think we all need to wear masks if we don't want to. That's my opinion. Because those that are scared are wearing their mask.
Right.
Okay?
Thank you, Janet.
My name is Amy Bradley. I live in Prescott. I'm here as a representative of Americans with Disabilities. There is some misinformation going around, and I've seen it posted on Linn County Facebook pages, that says that because of the ADA, anyone can claim that they have a medical condition that allows them to not wear a mask in public. This is not true, for 3 reasons. The ADA asks that you get permission first for any accommodation that you're going to get. So you have to contact the business and say, hey, I can't wear a mask and I'm going to be there. What can we do? The second thing is you get an accommodation. That means that that's something that is changed specifically that will allow you to access that facility or service, right? The last thing is they are allowed to ask for support. People are saying that you don't have to know what your diagnosis is, and it is true that you don't have to know the exact diagnosis. However, if you are asking for an accommodation like not wearing a mask or wearing an alternative like a scarf over your face or a face shield, they can ask, for what reason are you asking for that accommodation? That protects both the person who is asking for the accommodation and the business that they are patronizing, because if the accommodation is inappropriate and the person has a bad outcome because of it, that business could be held liable. Okay? So let me make that very clear. The idea that you could simply walk anywhere and say, oh, I've got a disability, I don't have to wear a mask, not true. The ADA does not say that. Okay? Now, let me add, the idea that you could only have people who are somehow afraid wearing masks, right? They've done studies, Tisha, I think, mentioned them. A number of them compared someone with COVID and someone without COVID. If the person without COVID is wearing the mask, it reduces transmission 10 to 15%. If the person with COVID is the only one wearing the mask, it's around 30%. If both are wearing the masks, the person with COVID and the person without, it goes up from 50 to 70, Tisha said 79%. If you take the fatalities that we have had in the United States since the outset of this, you would see that that would have saved 65,000 people. Yes? That would also include, that does not include the people that are being undercounted. The fatalities. You
guys,
can
let's let her
dispute
speak.
that.
Hey,
This is not a debate between.
Okay.
Make your statement and leave.
everybody,
Sorry.
let her talk, please.
But just to clarify, those statistics are available anywhere you go, and they are supported by science. Now, if you want to ignore science, if you want to think that your education leads you to be better prepared to make health decisions for people who are not you, your neighbors, your parents, the people those people come into contact with, then let that be on your conscience and yours.
Thank you,
Thank you. We'll take a few more comments.
Mitch.
Well, I'd like to.
You got to say your
Please
name.
step up here and just say your name.
You have to.
Thank you.
Okay, and God bless this lady and this guy for wearing their mask. And I would fight for their right to wear their mask. but I'd also fight for everybody else's right to not wear a mask, and I'll tell you why. I've watched these two people, and I do the same thing. I went to the doctor the other day, had to wear a mask. Okay, that's fine. But while I'm filling out the papers, I put on my reading glasses, they fogged up, air comes out. I don't know, I don't mean to pick on you, but I've watched you adjust your mask several times. So now that chair, if you had COVID, has got that on it. And that this pulpit that this lady touched has that on it. So I don't know if they're really effective, but like I say, I think if you are scared, wear a mask, and if you're not, I should have the same rights as anyone else to not wear one. So,
Thanks, Mitch.
and I'm not an expert, but I have read a lot, and I've read studies like she has. I've read studies on the opposite side. The experts cannot agree. So,
Appreciate your
I
comments.
look at it as a common sense.
You need to give him your card. You're
Frank, you
running
wanna
for
come up?
office. He didn't know you.
I'm sorry, I didn't mean to. I did the same thing the other day.
My name is Frank Pedersen. I think, in my mind, this is fairly simple. I think we should all have more information, more education, who is vulnerable, who is not. I think it is my responsibility to take care of my health. I will wear a mask if I just came back from a trip to North Carolina. At every place I went, I intentionally went to gas stations with few people. I would wear a mask, come back out of the gas station, clean, disinfect. Not because that I have it, but because I thought there is a risk here, and I don't want to bring that home. And if people are educated in who is vulnerable, and the government is protecting the people that are most vulnerable in elder homes, but especially give education. What do we need to do? You guys could recommend everybody ought to wear a mask, but especially the people that are vulnerable. And if somebody that, like I do, if I go somewhere, if I go to Walmart, I will wear a mask. Not because I think they're full of people there, but just to minimize the risk. But forcing the mask, I think, is wrong. But if we take care of ourselves, and I heard the deal that, okay, if you have COVID and you wear a mask, that you are protecting other people. And I'm sure that is right. But I'm thinking your natural response of your body, if you have a sickness in your lungs, is you cough, and you cough to get that stuff out of you. And they're talking about the virus, if you get exposed to a lot of virus, you get sicker than if you get exposed to a little virus. If you have the virus and you cough into a mask and you breathe that back in, wouldn't that create more virus? More, because it multiplies all the time. I've actually thought of a mask that has two filters, one that you suck air in and one that you put your expelled air into. If something like that was made, then you would protect yourself and protect everybody around you. But to force everybody to wear a mask, I don't think that is the solution. I think more education. Let people know who's at risk. Let people make the decision of taking care of themselves and not expect other people to take care of them or expect other people to make decisions for them. That's all I've got.
Thank you.
Thank you, Frank.
I'm Rosemary Long. I'm from Lacey, Kansas. A couple of points of orders of that. I graduated from the same class of nursing that your health nurse did, so I do have a background in nursing. After a back injury, I switched to teaching. I agree very much with what Mitch Clark said. If you feel like you need to wear a mask, if you think that that is a thing that you have to do, that should be your right to do so. If you do not believe that that is something you need to do, that should also be the thing that you do. A number that you should be aware of from Dr. Lee Norman himself is that 117 cases, and that was a couple of weeks ago, but 117 cases of the deaths in the state of Kansas came from the nursing homes, where people have been cloistered away and masked this entire time. That's not a good number. Why would we do it to the rest of the public? It's a very sad statement. We also should probably take a look at South Dakota, who has done none of this. No lockdowns, no masks, none of this mess. They have less than 100 deaths after all this time. So that's something to think about. Just numbers themselves. Studies can be skewed in whichever direction you want to skew them. Just like the COVID numbers, a positive case, if you become positive, sir, you're going to have to take a test, right? Again and again and again. Each time you take that test, if it is positive, they register you as a new case. What has that done to the numbers? These are some things to think about before you mask the public. If you feel like you want to wear them, man, I will fight to the death for you. But if you don't, I'd do the same.
Thank you.
Thank you.
Thank you.
I want to clarify, if you test positive more than once as one person, that is not considered a new case, as we have done that, and our case count is all new cases. It is not the same person.
Okay, thank you.
Thank you. We'll take a few more. You want
Thank you for the opportunity to speak. My name is Joe Perkins, and I pastor First Baptist Church in Mount City. And I was glad to hear that I think we have a 100% recovery rate in Linn County of the cases that we've had. 2 or 3 active, however you're counting that, but and the folks I know, they've recovered. So I'm thrilled at the 100% recovery rate we have in the county. I would just, my plea would be to trust people to make decisions for themselves. And there's certain things in our country, state, county that we trust people to make decisions on. There's certain things like seatbelts that the government has mandated. And in this one, I would make the appeal to trust people to make decisions for their health, which may not require it.
Thank you, Joe.
Thank you.
We'll take one more. Does anybody got anything?
My name is Edwin Barber. I'm from Pleasanton. I too concur with most what everybody's been saying, but I try to watch a lot of things and try to keep an open-minded, but I seen a decline in our cases, and then we had all the rioting. Now prior to that, they said if you had it, last I knew, stay 2 weeks, quarantine yourself. 2 weeks was fine to find out if you had it or not. Well, during that riot, I don't know how many weeks that riot went on, but it was over 2 weeks. I did not see anybody reporting we were getting COVID-19 on the same rate. As soon as that was up, all of a sudden you start seeing the COVID-19 spike out the roof. Bam, 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 bam. What happened during those weeks that everybody would be quarantined and nothing showed up? And then all of a sudden, out the roof. Another point, what is the size, molecule size of that virus? I don't know, I'm asking. And what size are the pores in the common mask that people are using? What is the difference?
They're carried by droplets.
And
Whoa, 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 whoa.
and
No.
so many of the masks that people are accepting that are being made, just sewing machine made, I don't know. Is it really going to make a difference? Number 3, anybody with some kind of facial that the mask cannot seal against is not very effective. I've been around military, been around OSHA. If that mask isn't sealing, you aren't doing a very good job. And so you need, even a clean face, that mask needs to be sealed to do an effective job. Those are just a few points I wanted to bring up.
Thank you, thank you.
Ed. All right, we're gonna close public comment. You guys, what, some stuff you guys want to discuss?
Mike, did you have some
Yeah,
legal?
I'd like to take 10 minutes to discuss a couple potential legal issues that might create in our decision and get some clarification from you.
That's your motion?
Yes.
Second.
Moving second, all in favor?
Aye.
Aye.
Not issued by phone.
All right, we're gonna get back at it so we go shoot some fireworks. So,
I've got a resolution that I just happen to have had prepared that I'd like.
That sounds odd, doesn't it?
do you have a motion, or do you have a number on that?
I'm looking
He's
right
getting a
now.
number. I'll read the resolution. It says, it's called an order exempting Linn County, Kansas from the face mask provisions of Executive Order 2052. Whereas the Governor of Kansas has issued Executive Order number 2052 mandating the use of face masks in all public areas, and whereas such mandate includes civil penalties for persons who do not wear face masks in public, and whereas Kansas House Bill 2016, Section 32 authorizes the Board of County Commissioners to issue orders relating to public health that include provisions that are less stringent than the provisions of the executive order effective statewide issued by the governor. And whereas the board has consulted with local health officials, and following such consultation, the board has determined that use of face masks in public is not necessary to protect the public health and safety of the county. Now therefore be it resolved and ordered by the Board of County Commissioners of Linn County, Kansas, sitting both as the Board of Commissioners and as the Board of Health of the county, that the board hereby determines and orders that the use of face masks in public is not required in Linn County, Kansas, and that Linn County shall be exempt from the face mask, there's a typo there, from the face mask provision of Executive Order 2052, but that citizens of Linn County are encouraged to use face masks when in public.
Resolution number would be 2020-13, if that's what you choose to do.
You guys didn't comment, you wanna make comment?
We're encouraged the use of face masks when in public. That's, it's gonna be a personal choice. I think we're in favor of this. I would encourage that if somebody was managing a facility, a restaurant, a business, or whatever, and they wanted to have a mask in there, that they post that well, so we don't have an inordinate amount of arguing and the police having to show up and creating issues inside the facilities. And I would encourage, if you choose not to wear a face mask and somebody wishes you be in there, you respect that. The same thing you guys are telling us, but I mean, just respect one another. I mean, everybody's got a personal choice, but it's got to be respected. And with that, I'll make a motion. We approve Resolution 2020-13.
I'll second that motion.
Moving second, all in favor?
Aye.
Aye. And I also want to just thank everybody for reaching out to me. I think we all feel the same. We just encourage everybody to.
I didn't know I could get that many texts on the phone.
You don't have Facebook, I'm telling you. It's
And you know what's going to happen, just as Gary pointed out, if there's a huge uptake, if this turns into a huge problem, well, it's going to be revisited. It just will be.
So we thank everybody for coming out. You got anything you want to say? With that, we're going to make a motion that we adjourn.
Make a motion, we adjourn.
Well, there's, is Tisha still here?
Tisha?
We had another issue that we need to talk about that has nothing to do with this,
Okay.
but it's a COVID issue.
But you're welcome to stay.
And come back Monday.
Never substitute. I mean, all what to expect. Like it's called down.
Jackie, have you talked to Jackie Messer?
Is she here?
Yeah, he. I'll take you over there real quick.
I'm sorry, I was.
Thank you all for coming out. Thank you.
He's got a culvert.
Oh, yes, sir. Yes, sir. I was hoping to give you some leverage to push him to do the whole of Cody and the clerk. And somebody else said, no, we'll worry about that later. It's not like it's going to be on
No, she's locked up in Presbyterian Village. They won't let any of those people out.
Really?
She's been there since February 2nd.
You have to do it. You have to maintain everything.
Slide it underneath the desk, under the table.
Okay, well,
They wipe it off.
Because
The Presbyterian Village down in Fort Scott.
Is that over by the hospital?
It's over by the college.
Oh yeah.
She's selling her log cabin, and so anything she does, she's not allowed. She can't go anywhere, and she's in good health. You know, you can drive around, but if you leave, you don't come back here.
Well,
I think
you can't-
she told
you
me
gotta
some
do
of
what
them were
you
sneaking
gotta
out,
do.
but
I
she
know.
wasn't brave enough.
Did you have,
You gotta do what you gotta do, I know that, but I thought, well, maybe I can get you to, my opinion is Lance is gonna, and a couple of, he's gonna be trying to talk him into doing anything that he can to do.
Well, he's done a good job of that so far.
Well, I've been watching 20-some years.
All right, Tisha,
I just was wanting to go
folks,
into,
could you carry your conversations elsewhere now?
thank you. Go ahead, Tisha, sorry.
I was needing 15 minutes in legal to discuss, something. What?
A COVID-related issue.
Yes.
I'll make a motion, we go into legal for 15 minutes with Tisha.
Second, we didn't do this backwards, did we? We should have done this first.
No.
Come running back out. No! Let's not print that. quitting?
I think it's working.
I seen them.
Well, it's been there 3 years. It should.
Do we have anything else we need to discuss? Did we already?
We can't discuss anything else. There's like,
Let's go. Let's go.
be in violation of code 444. You ready?
Did we already make a motion?
No, we.
I make a
yeah.
motion that we adjourn. Can I get a second?
Second.
Move second, all in favor?
Aye.
The red light means this thing's battery's going dead.
The red light.
He made me, he wanted me to be sure I knew that.
Who said that?
Chris, he said, and the red light means it's going dead, so you need to let me know.
Gentlemen, have a good evening.